Alright, so now for the next concept in X-rays that we'll be looking at is what X-ray absorptiometry. Okay, so from the word absorptiometry, you can just point out what absorption. I don't know if you understand. So X-ray absorptiometry is just simply looking at the bone density, how much of the X-rays is taken into you if they are actually trying to do an X-ray of you. Okay, so it has several other names. So it's usually called a Dual-Energy X-ray Absorptiometry. Okay, so sometimes it's abbreviated as what DXA, while sometimes it's abbreviated as what DEXA. Okay, so we get to look at how it works, its application, its advantages, its indications, the interpretation of results, and all of that. So this X-ray absorptiometry is commonly known as what? Dual-Energy X-ray Absorptiometry, which could be abbreviated as what DXA or DXE. It's a technique which is used to what measure bone mineral density. All right, you are doing it to measure the density of the bone. Okay, trying to see the amount of calcium that the bone has. So how does it work? Two X-ray beams. So this DEXA uses what two X-ray beams with different energy levels that are actually aimed at the patient bones. Okay, so one beam is absorbed by the soft tissue while the other beam is absorbed by the bone. When we talk about interpretation of results, you get to appreciate this more. Calculation: by subtracting the soft tissue absorption from the total absorption, the bone mineral density can be determined. Application: you use it in diagnosing conditions that are basically affecting bone density, like osteoporosis diagnosis. So this Dual-Energy X-ray Absorptiometry is a gold standard for diagnosing what? Osteoporosis, and also accessing what? The likelihood of that patient incurring a fracture. Okay. Then body composition. It is used to measure the body composition, including what? The total body fat and lean mass. Monitoring is used to monitor changes in bone density over time, especially in patients that are undergoing treatment for what? Osteoporosis. We're trying to see how the patient is responding to treatment. Advantages is non-invasive, so the procedure is quick, painless, and involves minimal radiation exposure. There's no cut, there's no surgery. Okay. Accuracy. Dual-Energy X-ray absorptiometry provides what? High accurate measurement of bone mineral density. Indications: if the woman is over 65, so it's recommended for women that are over the age of 65 and men that are over the age of 70, or even younger individuals, but the ones that have risks of what? Developing osteoporosis. Postmenopausal women. So it is indicated in women with what? Risk factors such as what? They have a history of fractures or long-term use of corticosteroids. Okay. Interpretation of results. T-scores. The results are reported as T-scores, which actually compare the patient bone density to that of a healthy 30-year-old adult. Okay. Then osteopenia and osteoporosis. So if you're having a T-score that is between -1 to -2.5, it indicates that there's what? Osteopenia. Osteopenia is low bone mass. While if you're having a T-score that is below -2.5, it indicates that there's what? The density has been lost so much that it's now tilting towards osteoporosis. Okay. So on that basis, that's what the concept of X-ray absorptiometry simply means.